Grace and peace from God our Father. We greet you this evening in the name of our Lord and Savior Jesus Christ. I am grateful to have this opportunity again to bring our house into your house as we share in this midweek experience. And tonight we have a very special midweek plan for you as we participate and engage in a COVID conversation. And before we move into the COVID conversation, let me also just say that this is day 3 of our season of prayer and fasting, and I pray and trust that each of you have been blessed by God this day and certainly are doing all that you can to manage the process, to spend time in prayer, to spend time communicating with God and each other, and more importantly, that you are strengthened by the prayers that you are offering. Do me a favor, send up some hearts and some likes, share this broadcast, whether you are watching from Facebook, YouTube, and or our website. Tonight, we want you to call a friend, tag a friend, because we want them to engage in this conversation. Do me a favor, hit that share button so that somebody else can be blessed by this opportunity to share in this COVID conversation. And so much is going on, so much has taken place since March of 2020. Our lives have really changed completely. And we have moved from a place where we knew nothing about COVID-19 to now, not only are we talking about COVID-19, but we're talking about the various variants, Delta and Omicron. We've learned new terms such as isolation, and we've experienced a shutdown as a nation. And in record time, there was a vaccine produced, and we have been aggressively encouraging people to take the vaccine, to get boosted, and likewise to make sure that their family members are vaxxed and boosted as well. But that's enough for me. We have some very special guests who are well informed in matters such as COVID-19, and I'm just excited and delighted to be able to introduce and to share our guest with us. Please, First Baptist, give a very warm welcome to our very first guest, and I want to introduce them all, get them all on the screen, and then we will hear from them in just a few moments. We're excited tonight to have Dr. Ben Schwartz, who is right here from Fairfax County. He is the county's epidemiologist, and we're grateful that he is sharing with us tonight. He is a wealth of information, and we look forward to hearing what he has to share with us. We also have tonight joining us from Fairfax County, Miss Nikki Brown, who is the community health specialist, and we're grateful for her presence as well. We also have one of our very own in the person of Dr. Mahia McCuston, who is a pediatrician and has an office in Washington, D.C., and we're grateful to have her with us tonight. And last but not least, we have with us Dr. David Gordon, who likewise is no stranger to us. He is a professor of pathology. He has shared not only with us, but with many of our Northern Virginia churches, and he is a professor, and he is active emeritus, and we're looking forward to hearing from all of our panelists this particular evening. If we could put them all on the screen, please, First Baptist, give them a very warm welcome with hearts, with likes. Make sure that they know that we appreciate their time and their willingness to share with us on this Wednesday evening. Good evening all. I'm delighted to be able to welcome you to this particular platform. And I want you to know how appreciative I am for your time and your willingness to share with us tonight, and to not only to share your time, but to share your expertise. As I've already said, we're living in a time where this time 2 years ago, many of us had never heard of COVID-19. We've learned a whole lot of new terms. We've been engaged in a whole lot of new activity. We've lost a lot of friends. We have been consoling lots of families. More recently, we have been encouraging people to get vaxxed and to receive their booster. But tonight we want to hear from the professionals. We want to hear from you because it's been a long time since we've had a COVID conversation, and we want to hear directly from the professionals. We're turning on the television each and every day, and in some cases there's a new story, new news. In other cases it's reinforced, but we're glad that you're here tonight so we can hear firsthand and be able to ask you questions as well. And so, ladies and gentlemen, if you're watching, please listen attentively and get your questions ready because we want to be able to answer the questions that you have this evening uh, during this particular session. So I'm going to begin with Dr. Ben. If you can just greet us tonight, tell us a little bit about who you are and some of the work you've been engaged in as relates to COVID and specifically Fairfax. And let's hear from you tonight. We can't hear you. If you could, yeah, there you go.
Okay, there. Thank you so much. It's great to be here, and I really appreciate being part of this panel. Um, so I am a physician. I'm an epidemiologist at the Fairfax County Health Department, and as an epidemiologist, I deal a lot with numbers. So I'd like to start out by just sharing a few numbers about what the impact of the pandemic has been in the African American community. Um, the highest rate of COVID disease in our community actually has occurred among the Hispanic population, with the rate in that group being 2.5 times the rate among the white population. But it's followed by the African American population. And in that community, there is a 75% higher rate of COVID disease compared with whites. So a disproportionate impact. It's also very similar if you look at the impact on deaths in the African American community. That also is 75% higher than the white community. And one of the other things that we're seeing is that the African Americans who die from COVID tend to be younger, tend to be about 8 years younger than the white population who unfortunately also die from COVID. And so there are some disparities that we're seeing here, and even bigger disparities that have been seen in other communities around our country. So, of course, the question that people ask is why do these disparities exist? And there are several reasons that we think are significant. One is that more people in the African American community may have jobs where they're unable to telework. They may be more likely to be taking public transportation, having a little bit more difficulty socially distancing, more crowded living situations. And in terms of the higher rate of death, we know that among the African American community, there also are higher rates of heart disease, there are higher rates of high blood pressure, diabetes, other conditions that may increase the risk of severe COVID illness. Um, so that's a little bit about what we're seeing with the numbers. But when you talk about the impact of disease in a community, it certainly goes way beyond just the numbers. And I'd like to talk a little bit about a research project that I was working on with some colleagues from Johns Hopkins University. And what we were doing was looking at different communities around the country, at Hispanic communities, African American communities, and also Native American communities, and trying to learn more about what people's experience of the pandemic has been. And as part of that project, we did national surveys and we also held conversations with African Americans in Baltimore and New Orleans. And I found some things that are really interesting to me. And just by looking at me, you can see that I'm not from the African American community. And so, this is something that I found really significant being able to participate in this work. And so what we found was that there are real impacts of the pandemic in terms of trust, with low levels of trust in many African Americans, in among trust in government, trust in the medical community. There is some skepticism about vaccines and skepticism about the profits that vaccine companies are making. There are concerns about people being experimented on. And also, we've heard questions about why is public health coming to our community now?
Mm,
And where have you been these past years when our community has suffered other problems, other disproportionate health impacts and community impacts? And I have to tell you, this I've found this experience really significant, and that, working with Nikki and working with others in the health department, I just really want to share my commitment to
right.
working more closely with the community, rebuilding some of that trust.
Dr.
And
Ben, that's a great that's I don't want you to lose that thought, but I want to do some more introductions, but we want to come back to this whole idea and notion of trust, okay? We're gonna come right back there.
Perfect.
Dr. David Gordon, would you tell us a little bit about the work that you've been engaged in as relates to COVID-19? Don't forget to hit that mute button, unmute button.
So thank you very much, Pastor. I'm Dr. David Gordon. I'm a pathologist at the University of Michigan, and I've been in the midst of this whole pandemic, unfortunately, from a pathologist's point of view. So let me just say at the outset, particularly in anticipation of the question answer period, no question is a dumb question. All questions are politically correct as far as I'm concerned. We really want to get your questions answered or any concerns addressed as best we can. So, I mean, one question that I've had to deal with, I think we've had to deal with nationally, is some doubt, frankly, about, the reality of COVID and being how serious it can be. Well, I can tell you from firsthand experience, being a pathologist doing autopsies, I do see the bodies. And so
Wow.
there's no doubt that people are, some people, it's a small, maybe a relatively small percentage, but people are dying from this disease and they're still dying from this disease. And we still have cases, coming into our morgue as far as that. And unfortunately, right now, we're in a time period, and I defer to other experts on the panel to certainly weigh in. The vast majority of people who are now being hospitalized and also dying are people who are not vaccinated against this disease. And so, to me, if I had to leave you with one point, that is to, by all means, everyone who is eligible, go out and get a vaccine if you have not been vaccinated. And if you have been fully vaccinated, make sure you get your booster shot, because this right now is very important in terms of not only helping to prevent serious disease, but also hopefully helping to prevent this further spread of this epidemic. It's a shame that we're in our fourth surge of this, pandemic right now. And I think we really need to be able to be very wise in terms of how we do that. A couple of points I want to make because, and again, I'm going to be a little bit selective here. I know that there are some people who are very skeptical of vaccination and even up to this point have not been vaccinated. I want to be able to address, and we can maybe do this now, but also later, any concerns that people have about the vaccine. I mean, first of all, initially, people were concerned that they were being experimented on. Well, by now, we've had millions and millions of people, not only in the United States, but across the world, who have received this vaccine. And yes, there have been a few adverse events, but this is no longer in the experimental phase, if you will. We have a lot of data that this vaccine is essentially very safe. I've been vaccinated myself. My family's been vaccinated, as an example. Very few side effects. Yes, there are some people who have had some adverse events, but there are ways of being able to mitigate this, particularly if you have a tendency towards allergies and things like that. So I see no reason why people should not be vaccinated. The other point I want to address is that there may be a few people now who are saying, gee, if it's true that people who are vaccinated can still get infected, then what's the use of the vaccine? And I can understand people, raising that question. Well, I'll just say right now, I'm actually an example of someone who's been fully vaccinated. And despite my wife and I being fully vaccinated, we recently came down with, COVID. But luckily, it was a very mild cold for me.
Mm,
And I think if I had not been vaccinated, given that I'm 70, have some comorbidities, for example, I've recently had open heart surgery and things like that, I could have easily have landed in the hospital and been in pretty bad shape if I had not been vaccinated. So again, I encourage people to be vaccinated. I think the other thing that you need to understand is that the way vaccines work, I mean, some people I know feel that, gee, if I'm vaccinated, then I should have this metal shield around me, and there's no way a virus is going to get past that metal shield. Well, unfortunately, that's not exactly the way vaccines work. Vaccines help to build up your immune system so that if you do get infected, it can rev up very quickly to fight that infection. The analogy that I like to use is this is similar to you having your house in the neighborhood and having a fire station down the block, for example. The fire station down the block isn't going to prevent you from getting a fire started in your house. However, being able to call that fire station very quickly, they can quickly respond, rev up to that emergency and put out the fire quickly before your whole house burns down. So that's the way I think of vaccines. And so, again, this is very important. And again, right now, I can't underscore the fact that the vast majority of people who are having bad outcomes with this disease are those people who are unvaccinated. Now,
thank you so much.
Discuss other things further, but
thank you so much, Dr. Gordon. Let me tell you, the questions are already pouring in. So I want to get past these introductions so we can jump right into the questions that people have. Let's hear from our pediatrician, Dr. Maia.
Sorry, I was clicking on the wrong button. I am Maia McQuiston. I'm a pediatrician, and I am the owner of a practice that was yesterday 11 weeks old. So I'm very happy. But I also worked throughout the entire pandemic practicing, and I did not take a break. And I will say that unfortunately, in the past 2 weeks, I have seen more COVID in my patients than I have in the past 2 years. And there is it's not a myth, it's true. Children typically don't get sick when they get COVID. However, it doesn't make a difference with a statistic when your child is the one child in a million that dies. And so I have a very big concern with the current Omicron variant because children are getting sicker. There is data from New York hospitals that the hospitalization rate starting December 7th was 395% higher than it had been at any other point in the pandemic. What I have seen in my own patients is that children actually are sick. It used to be that kids would not have symptoms, but I have had babies as young as a month get fevers. And if you are not familiar, when babies get fevers, if a child less than 6 weeks old gets a fever, it's a full court press. They will go to the hospital, get a spinal tap, get blood drawn, get a urinary catheter. And so if I can encourage everyone to get a vaccine until those of us that can't, meaning my little people that can't get vaccines, they're extremely vulnerable. I will just say one thing about the vaccine. People are concerned. The Pfizer and Moderna vaccines are mRNA vaccines. Those vaccines don't, once they do what they're supposed to do, they die. The body, they don't live in your body. They do what they're supposed to do when they're done. I'll take questions later.
All right, okay. And last but not least, Nikki Brown, also from Fairfax County, our community specialist. Nikki, you want to talk a little bit about what's been happening in the community as relates to COVID-19?
Yes, thank you everyone for having me tonight. I am a community health specialist with the health department in Fairfax County's outreach team. Our team is really special. I like to brag about our team because we have community health specialists that are dedicated to different ethnic groups in the community. My role with the Fairfax County Health Department is to conduct outreach specifically in our African diaspora community. So I've been working very closely with our Black residents throughout the entire pandemic. We've been working really hard with our community partners, nonprofits, with our places of worship, with our barbershops and hair salons, with our advocacy groups, with regular lay community members to coordinate vaccine clinics in the community where people feel comfortable. We've also been working very hard to provide access to good information about the vaccine. So we've been having conversations in small businesses, at community centers, on the basketball courts. And we've literally been in the streets, at the bus stops, at the thrift stores, just talking to people, addressing their concerns, and letting people leave the conversation with a better understanding of the importance of vaccines and how they work. So that is what I do pretty much in a nutshell. And I look forward to continuing this conversation.
Thank you. Thank you so much for your advocacy. Thank you so much for the work that you're doing. I want to pose the first question that comes from Facebook, and then the team will also list some questions on the screen for us as well. Deacon Michael Clinton has this question. He says, can COVID be passed by touching a piece of paper or pen which had been touched by a COVID positive individual? Who wants to jump in there?
Okay. Hi, I'm Dr. Gordon. Yeah. So this has been something that's been a concern raised for a while, but I think now that we've had a number of epidemiologic studies with case tracing and things like that, by far the main method for transmittal of COVID is through aerosol spray. So this is when people talk, when people congregate, it's the small droplets that come from an infected person that you project out of your mouth. And some activities project a lot more. Unfortunately, it's public speaking and singing are two particular things that really project a lot of these aerosols. And by far, that has been the main thing. It is true that when people did early on, they've done some studies about coronavirus being on surfaces such as paper, countertops and things like that. And that's one of the reasons that we try to decontaminate those surfaces. However, I think some other studies have suggested that that's probably a very unlikely way that people get the disease. If you do contact tracing, for example, most of the cases of people getting infected is because they've been in an enclosed room, for example, with a lot of other people, and someone has been uninfected or has been in a place with poor ventilation or has been on maybe a bus or maybe local transportation or something like that. That by far seems to be the much more common way things are transmitted. The other thing to keep in mind is that, and this, I don't want to get too technical here, but you can detect the virus on certain surfaces, but many times the virus can be detected, at least its RNA can be detected, but the virus itself can be no longer viable. So there's a difference between being able to detect the mRNA from the virus and being able to actually have intact virus. And so people have done follow-up studies and said that, yes, I may be able to detect the virus, say, on a pen or a piece of paper, but when I try to go and culture the virus, I can't culture the virus because the virus is no longer viable. Whereas it can culture the virus from people's aerosols and other types of secretions like that. So the bottom line is by far the biggest way this is transmitting is people getting together, and it's mostly aerosol, people breathing on each other, people projecting lipid droplets on each other, things like that. That's by far the main way that this disease is spreading.
In response to that, and can someone talk about what seems to be the difference between the Delta variant and the Omicron variant, and why this variant seems to be, so rampant, and the difference between the two? You turn to your left, you turn to your right every day. There's someone is diagnosed. So what's the difference between the two?
I think
Right.
the way that the coronavirus is if you have your hand and you have these spikes, what happens is that it mutates and it changes, which is one of the reasons why it's so important for us to get vaccinated, because the more virus there is and the less people are vaccinated, the virus changes. And so there was Delta, the spike proteins changed, and then throughout time, the spike proteins change again. And so Omicron is not as virulent or does not cause as much disease or serious disease in certain populations, but it is extremely contagious.
And one of the things that we're seeing with Omicron more than Delta is that the effect of vaccines in preventing mild and moderate illness is lower. And so more people who got vaccinated can still get that very mild illness. But as Dr. Gordon said, the vaccines still do a really, really excellent job protecting people against severe disease. And that's true for Omicron, just like it was true for Delta.
Okay. Sister Maria Carter has another question. How many times can a person be diagnosed with COVID-19?
Now, let me not answer that question directly. The answer I would say is I don't know, but it brings up something that I have when I'm testing people. I will say that if you get tested and you have a PCR test, getting another PCR test is not the best test as a test of cure, because that test can remain positive for a long time. So that just clicked in my head. That doesn't answer that question. I will defer that to someone else.
Yeah. So I can expand on that, but before doing that, Again, yes, it is possible. There has been documented cases of people being infected more than once with coronavirus. I don't know. This is still an area where we're still doing research and we're still learning an awful lot. My guess is that, if they get infected by one variant, they have an immunity to that variant. And then there's probably a second variant or different variant that they may get reinfected with. That would be the presumption, because the variants look different to the immune system. And so the immune system may not be able to rev up as quickly to eradicate the second variant. I will say, people often wonder how these viruses change. And, I don't want to get into the weeds in terms of some of the molecular biology, but just understand, as long as we don't have, as a community and as a world, have this virus controlled, this virus is going to continue to spread, replicate. Each time it replicates, it makes certain changes in its DNA, in its RNA composition. And eventually you get certain changes that we call the mutations, some of which may be more advantageous. So we don't know. I've not seen a study that has specifically nailed down why Omicron is more infectious than, say, the Delta variant. But things that changes in the attachment protein, for example, where the virus attaches to cells, things in terms of how rapidly a virus can actually reproduce itself and things like that. You have changes on those sorts of things. And it selects for those types of viruses that do more damage. So yes, we may see the emergence of even future variants that we may have to deal with.
Okay. Dr. Ben, can you pick up Tracy Marsh's question? Is COVID a variation of the flu?
COVID and flu are totally different viruses. So the flu can be prevented by the flu vaccine, and the COVID can be prevented by the COVID vaccine, but the two are entirely separate and there's no crossing between them.
Okay. What is the risk for illness for persons half vaccinated who've only received one of two shots in the Moderna or Pfizer vaccine regimen?
Unfortunately, with these new variants that we've had, there is very little protection from a single dose of vaccine. So if you got that first dose, you're well on your way to getting protected, but you do also have to get the second dose. And then when it's time, after 5 months following the second dose of an mRNA vaccine, you also have to get the booster that will jump your immunity up to a much higher level. So get fully vaccinated. It's really important.
Which leads to, so if you are you safe with the vaccination but not the booster?
There was one study that was done with Omicron that showed that if you're vaccinated, and if you've been vaccinated a couple months ago, but you haven't gotten the booster, the vaccine may prevent about 35% of infections. If you do get the booster, it prevents between 75 and 80% of infections, so more than double the effectiveness. And so that booster is really important to get.
Okay. Before we get to the next question that's on the screen, can anyone speak to the vaccination rate right here specifically in Fairfax County? Does that be Nikki or Dr. Ben? How are we doing as a county among eligible persons?
Yeah, I haven't looked at the numbers really recently, but I think we're around 80% of people who are eligible have been vaccinated. The one group where we need to do better is vaccination of children between the ages of 5 and 11. And we're kind of stuck somewhere around 45 to 50%, and the numbers are not going up fast like they should be. And so really we have to better understand why parents are reluctant to get their children vaccinated, and we need to address their concerns. And, I think our pediatricians and our medical community can really help people understand and overcome some of those concerns.
if there is a parent who's watching who fits that particular category, tonight is your night to have your questions answered. We'll even bring you on the screen if you're willing to come face to face with these doctors and health specialists. So if you're out there, please let us know, and we'll bring you on. Nikki, you want to speak to some of the events that are taking place that where these vaccines are being distributed?
Yes, so we are having these events at various school locations in the county. And I also can share links in the chat. I don't know if I can share that with the tech person, where people can find which vaccination clinic is closest to them, but there is a lot happening in the county right now. I also want to kind of add to Dr. Ben's comment about the low vaccination rate in children. What I'm seeing a lot, and I don't know if there's any parents on the line that can speak to this, but what I'm hearing a lot in the community is that a lot of parents who were okay with getting the vaccine for themselves are very concerned about the safety of this vaccine in children. And then I'm also hearing a lot of parents who believe that it's not really too necessary to get the vaccine because children are not getting as sick from the disease. So those are the two biggest things I'm hearing when it comes to children 5 to 11 in the vaccine.
And based on Dr. Maia's earlier comments, children are getting sick.
Yeah, it's interesting. When we talk about vaccinations as a whole, I think that's actually one of the most important things that I do is vaccinate children against these illnesses. So if I throw out chickenpox, no one thought we needed to get chickenpox vaccine. Yeah, I had chickenpox, other had chickenpox, but there were 300 children per year that died from chickenpox before we had the vaccine. And so my concern is that do we have to wait till there are a larger number of children that die from COVID till we really understand how serious it is? I mean, children are having fevers that last up to 10 days. We're talking about emergency departments being inundated. I've had patients who sit in the emergency department for over 8 hours because they have COVID and they need to get care. And we still have something called MIS-C, which is multi-inflammatory syndrome in children. And what that is, it's basically like your body has a severe reaction to COVID, and these kids are in the intensive care unit. And again, these kids can't be protected. And one of the greatest rates of transmission, there was a study in Canada, it talked about 3-year-olds. 3-year-olds that got COVID positive were more likely to spread it than 16-year-olds. And this was prior to the vaccine. So not only are they now getting more sick, but they're also easier to spread. And so, like I said, over the past few weeks, I've seen more than I have, but they get the virus and then they spread it. And so there's still a large number of adults that don't have vaccine. These children can't get the vaccine, but they're getting sick, and they are a super spreader event in and of themselves.
So I don't want to cause a political nightmare or storm, but it begs the question, how safe are kids in school that are not vaccinated?
Well, I think we need to always consider, I don't ever want anyone to do anything they are not comfortable with doing. But I think from a public health perspective, if we are not comfortable having our children vaccinated, then they should be able to have alternative ways to get an education. It does put everyone at risk. It puts the teachers at risk. It puts the other students at risk. And it's actually very scary. I don't think that we should just say everyone has to do it. I think we have to have a conversation so we can understand the pros and the cons. There are very few contraindications, or there are very few reasons that we will tell you not to get this vaccine. And the studies are clear. I've had my own patients that actually have participated in the study. Moderna has been studying down to 6 months for the past 6 months, and they're ready to release their data. There are very few bad outcomes. Children actually do better than adults. So the Pfizer from 5 to 11 is a smaller dose than the adult vaccine. They didn't just say, we're going to give the same. They studied a smaller dose, and it's a third of the dose. And then if they go younger, it may be a 10th of the dose. So they're doing what they're supposed to do and making sure that it's safe and it's more effective. younger children need less vaccine because their immune systems are more robust.
Dr. Ben, Dr. Gordon, you want to weigh in on that subject of children in schools?
I would say that schools are safer than most people may think they are, that we have what's called layered protection. And so there are a number of interventions that are implemented in schools, all of which help keep kids safer. So many of those children are vaccinated, the teachers are vaccinated, they wear masks in schools, which is incredibly important. They are distanced to the extent that they can be distanced with the number of students who are in a school. They've improved the ventilation in schools, and they've worked very hard to do this because, as Dr. Gordon said, the aerosols are what carries the viral particles, so they've improved the ventilation. And when you put all of these different protective measures together, you actually can create a pretty safe environment. Now, certainly we can make it safer if people make a decision and get their kids vaccinated. So that still, as you hear, that's the message that we're all sharing tonight.
Yeah.
Absolutely.
And just if I can add, from a safety point of view, I mean, you've had, I don't know what the current numbers are of kids that have been tested with the virus and have been vaccinated, but you're approaching millions probably of children who have been vaccinated. So we're not talking about something that we don't have any understanding of. I mean, we're talking about something where there's a lot of information, hardly any side effects, that are being reported in terms of serious things. And then the other thing to keep in mind, again, likely adults, at least here in Michigan, for example, our pediatric hospitals are filling up with cases of people who are being hospitalized, children, I would say, they were being hospitalized. So, and again, I think the vast majority of those also are people who are unvaccinated. The final thing I would say is that sometimes people will say, well, vaccination is the last ditch thing that I'll consider. But remember that you need to be vaccinated weeks ahead of time for it to be effective. You can't just wait until you get the disease and then think you're going to get vaccinated and that's going to help. It's sort of like saying, gee, I don't have a fire station down the block, but I'll wait until my fire starts in my car and then I'll start building a fire station. That fire station is going to take a while. It's not going to be that helpful to you. You really have to do this weeks ahead of time. And so again, I think we all are in agreement that by all means, if you can get vaccinated, you should be vaccinated.
Okay, let's get back to some of the guest questions. Do you foresee a need for an annual booster?
I would say
where are we headed?
We don't know yet. I mean, for certain diseases, like as we know with influenza, we do have to have sort of annual shots and things like that, partly because that class of viruses does change. I think we are seeing that in the case of coronavirus or the COVID, that is demonstrating its ability to change, but we don't have a good understanding as to how many more variants are going to be, coming down the pike. And so we may have to have that. I think one of the good piece of news is that now and it's really not new technology, but it's being applied in terms of these mRNA vaccines, we can more rapidly generate a vaccine targeting a new variant than we could say several, years ago. So we're in a good position in that sense, in terms of being able to say, if a variant comes along that is resistant to our current vaccines, chances are within a few months, companies can now generate a new vaccine with this newly used technology. So that's something that's a benefit. And I think we'll just have to see how time goes. I don't know if Omicron is the last variant. Historically, just being a betting person, I suspect is not the last variant. And we'll just have to be able to be capable and able to respond to any new variants that might come along.
Okay. Tracy Morris is on it tonight, and here's a question. Many are asking the CDC, and there's been lots of changes. What's the isolation period these days after testing positive? We've heard different numbers. What say ye? What should we be doing?
Yes, let me see if I can bring up share this a screen. I don't know if people can see a screen I've got here, which is a diagram of actual coronavirus infection. Can people see that?
Not yet.
Let Let me see, go back, hold it. Give me a second. Hold it. Let's see what is going on here. Entire screen. Let's see if I do that. Now can people see what I've got here? Hold it for a second. I tell you what, you may want to move on to another question while I'm trying to get this worked out here. This is a new system that I'm not.
Okay.
Can I just take a crack at that question?
Sure.
Yeah.
Right. Go ahead.
So isolation recommendations now from CDC, I would say, are 5 + 5. So that's 5 days of isolation. That means you need to stay home and away from others. And then if you're feeling better, if your symptoms are entirely gone or very much improved, and if you don't have fever anymore, then for the next 5 days you can go out of the house, but you need to really be very rigorous in terms of wearing a face mask. So 5 days of isolation plus 5 more days of wearing a face mask. And the new recommendation, that recommendation comes because CDC's been able to collect and analyze some additional data. And the data show that this gives you good protection against spreading the virus.
I just want to be clear, Dr. Ben, but those are for vaccinated individuals. So
for isolation, it doesn't matter if you're vaccinated or not vaccinated. For if you're exposed but not infected, then there are different recommendations for quarantine based on whether you're fully up to date with your vaccines or if you're not.
right. So I'm sorry, I didn't finish. So what I'm saying, so the CDC has different recommendations. So I'm going to share what I do in my office because I'm a little bit more concerned because the majority of my children are unable to be vaccinated. And so I actually tell them 10 days. And so there's quarantine, like you were saying, there's quarantine, there's isolation, and there's out of school, and there's testing. I think one thing that we all need to keep in mind, we have these tools in our toolbox. We have masks, we have testing, and we have vaccines, and we all have common sense. And so I think what I think about when I send kids back to school, there are some people that still require 14 days. There are some people that still require 10 days. And I think, and again, I'm speaking again from a pediatrician's perspective, and I have to always write about when someone can go back to school. And for me, also when someone can come back into my office. And so for myself, it's usually, there's one contact, but if you have COVID and you have a symptom, that remember that the timeline starts the day after you have a symptom. Or if you're asymptomatic, the timeline starts the day after you have a positive test. So those 5 days, they're not the day but it's the day after. And for me, again, I'm going back to just what I've seen and what is important to keep people healthy. I use the CDC as a guideline, but I don't use it as the end all be all because I still think we're in a world where children aren't always the first thought. And so, again, I typically would say that it's a 10 days. There are still certain schools and daycares that say 14 days. I do not recommend testing to go back, particularly not a PCR test, because those tests can remain positive for months. But if you do have to get a test back, then I would request to get a rapid test. I know that doesn't really answer the question, but that's actually just what I do.
Okay. I don't know if
it may not answer the question directly, but this dialogue and exchange gives us an idea of the complexity of the issue. So I appreciate you both for sharing. Dr. Gordon, I think we have that document and we're able to pull it up for you if we can. Yes.
Yes. Okay. You're able to see. So this is a summary graph, and I apologize for the complexity of this, but it brings out a number of different points. So this is a summary of things. Basically, starting with the time 0 here is when a person gets infected. And a couple of important things. 2 days approximately before that person develops any symptoms, it turns out that person is making a lot of mRNA, which is what this blue line shows you, before they're making, detectable protein as virus. So they are infectious typically from the first 2 days before they develop the symptoms to up to about 5 to 7 days, or in some cases 10 days after they develop symptoms. This is very important, and this is partly why asymptomatic people can in fact spread this disease. Now, this graph also shows you approximately this curve here. The green curve is the curve of actual virus production, and that kind of mirrors the ability to culture virus during that time. So this is kind of an explanation as to why you have these recommendations. So that's why the CDC and other places usually say, if you know you've been exposed to someone who has the virus, understand that you may want to isolate yourself because you are infectious before you get symptoms, even if you don't get any symptoms. And then once you start getting symptoms, it's the 2 days right around the time you start getting symptoms that you are the most infectious as far as being able to spread this virus. The RNA will lag on for many weeks afterwards, whereas the protein portion, which more represents actual viable virus that can infect someone else, that tends to go away. And this is the reason for them not recommending that you get follow-up RNA tests or PCR tests, so-called, because this can stick around even when you no longer have viable virus in your system. And then the other thing this graph shows is that with a one-time infection, it takes a while for your own antibodies, in this case showing you IgG and IgM, to rev up and start growing, and so people again need to understand that if you're going to get vaccinated, and vaccination would do a similar thing as far as the antibody production, it takes some weeks for those antibodies to really become available to really serve their protective function. So I know this is kind of confusing. Just in shortness, the PCR test detect the RNA, and that's good for telling you whether or not you had a recent infection, even if you're asymptomatic. The so-called kits that most people have, the antigen tests, they're better correlated with whether or not you are infectious, is a rough way of thinking about this. And that will later become negative. And I don't know if the counties that are basically saying, gee, if you've had a positive test, then maybe you ought to consider staying home for a while. The final slide, if I can get it, this is a summary of the CDC guidelines. I don't know if you can see that, but this is a nice summary card, which is showing you, let me see, I hope I've got this, okay, which shows you basically, again, the guidelines. So if you are vaccinated or unvaccinated, they want you to stay in about up to 5 days in isolation and not be in contact with other people. This is with a confirmed infection. And then after that, you can go out back again. But they still want you to wear a mask. They still want you to social distance and things like that. The other thing I mentioned finally is that different counties and different organizations are making modifications to this guideline. So for example, University of Michigan recently has put out for this whole campus that if you get infected, they want you to stay home for 7 days, not 5 days, and different places may do that. So you want to not only follow the CDC guidelines, but check with your local offices of public health and see what they recommend and follow those recommendations.
Thank you so much. We're nearing the end of our time together, so I'm going to ask you to do what might be difficult. Some talk shows, they end with rapid fire. So we have just about 2 or 3 more questions. And the first one is, will the new normal mean living with COVID variants everywhere? Rapid fire. Who's got the quickest response?
We right now live with influenza everywhere. But I think, you can have a decent life with influenza. I think there's certain types of things that we can do that, may seem like an imposition. So, for example, I noticed in a lot of Asian countries, people are used to wearing masks, particularly if they're infected and things like that, and so and I think during this pandemic, we've probably seen a decrease in influenza, in part because of people been wearing masks and things like that. So we can have a new normal, but still have a life where we can interact with other people and do that. But it helps to get vaccinated, believe me.
We cannot end this conversation without talking about the difficulty with testing.
Mm-hmm. So
yes.
Go ahead. I'll let other people weigh in.
Dr. Ben, Nikki, particular, what about testing here in Fairfax County?
We are increasing the number of testing locations. We are currently in the final stages of opening up a testing center that will be up and operating by next week. We're looking to open testing centers in areas of the community to give people more options of where they can go and get tested. So that we know that there's a problem right now, and we are working hard to solve that problem, and there will be more options within the next couple weeks.
Okay. Prior to us coming on the air, Dr. Maia, you informed us of some information that you just recently learned, and could you share with our guest audience tonight related to testing?
Oh, so
Yes.
I actually myself, I do testing. It was actually Nikki who brought it up at me too. So I heard on the news this morning too, but your insurance companies will now reimburse you or pay in advance for home testing. And I believe it's up to $150. So if you get up to 8 rapid home tests per month, your insurance company will reimburse them. Did I get it right, Nikki? Yeah. And I also said in my office, we will test, the parents of our patients, and we will just give them the receipts so they can get reimbursement. Now, I will say also, just to piggyback on that, you can also use your FSA funds at any time to get those tests in advance. So your insurance, you don't have to use your insurance.
Thank you. What types of face masks offer best protection from Omicron?
N95 or K95?
Yes.
I wear 3 masks a day.
3 masks at one time?
Well, because I like cute masks so the kids can see them, and then I wear, the little surgical mask, and I wear a surgical mask, a K95 mask, and then I will wear usually something cute on top of it.
Okay. I want to give this last question to Zanita Harper, and she says she really wants to know if would it be safe for a child or adult with lots of allergies? Is the vaccine really safe to take without any side effects?
I don't think you can ever say there will be no side effects. There is no 100% guarantee that there will be no side effects, but it comes down to, unfortunately, the risk and the benefits of the vaccination versus not. And you should be comfortable. I'll let Dr. Ben or Dr. Gordon or Nikki even speak to that. Unfortunately, there's no way to say there's no side effects.
Well, what I would say is that there is no relationship between an allergy to the vaccine and allergies to foods or to dust or to mites or to pollen. So some of these things that kids have common allergies to really don't increase the risk whatsoever for having an allergic reaction to the vaccine.
Mm-hmm. Yeah, the other thing that I would add is that when you go, I'm sorry, go ahead.
No, just really quickly, I just wanted to insert in there that both of my kids have severe allergies, and they both have gotten their vaccines, and they actually did not experience any side effects from the vaccine. Not to say that that wouldn't happen to your kid, but my children are fine. I just wanted to put that out there and just remind you of just how many children so far have already gotten the vaccine locally and nationwide, and we haven't seen any major complications yet with the vaccine.
Yeah. One final comment is that when you go and get your vaccine, typically what they do is they give you the vaccine, but they ask you to sit around, and so they observe you to see if you're going to have any acute effects of the vaccine. And since this usually is done in a medical facility, they're able to intervene in the very rare case that you have a severe allergic reaction in terms of being able to give you epinephrine or other types of things like that. So again, they try to make giving the vaccine as safe as possible.
I want to thank each of you for joining us tonight. I want to thank our listening audience for joining us tonight. I want to give you just a moment to offer your very last words before we close tonight. If there's one piece of advice that you would want to leave with our listening audience to ensure that they share with their family and friends and networks, what would that advice be? Dr. Maia.
I would just say keep using the things that we have in our toolbox. We have masks. We have 6 feet in between us. We have vaccines, and we have common sense.
Nikki Brown. You're
I
on
would
mute.
say that many of us are already vaccinated. So I think it's really important that you continue to have those deep conversations with your friends, with your family members, reminding them that you got it, reminding them that the vaccine is safe, and just pointing them in the right direction. Just stay on it.
Dr. Ben.
I would say if you want good, reliable information, talk with your healthcare provider, but also do talk with people who have gotten vaccinated, who you trust, who are in your community. Find out what their experience was.
Dr. Gordon.
Get vaccinated, get vaccinated, get vaccinated. If you're not vaccinated already, that's what I would say. And get boosted afterwards.
I like that. That's a great closing message. Again, we want to thank each of you for sharing with us tonight, for helping us to understand better this particular virus and what's important to us as a community and what we need to do to take care of ourselves. I want to thank our listening audience. If you're sharing with us tonight and you're not a member of First Baptist, please hit the link, fill out the connection card that we might be able to communicate with you about opportunities that are upcoming in the future. We also invite you to share with us and worship. And remember, First Baptist family, next week we begin our new Bible study series, I Will. And so we encourage you to join us on next week. And for those of you who are participating in our fast, stay strong. And we'll see you on the Zoom platform in just a few moments that we might close the night together. Thank you for allowing us to bring our house into your house. For all of us represent the household of faith. Have a great night, and may the Lord bless you.
Thank you.